So what is a migraine? A migraine is a really interesting neurological condition that is centered around the trigeminal vascular system. That's a fancy term for basically your trigeminal nerve is what innervates your face in the ophthalmic branch, the maxillary branch, and the mandibular branch. It also innervates your chewing muscles and your eye sensory information, not your vision. But it is a major cranial nerve that then travels into your brainstem and then synapses with some different nerves there, including nerves from your neck. And this nerve, through a variety of different systems, is able to be sensitized, and it can then suddenly spontaneously discharge, causing the blood vessels in your brain to dilate, and that's what leads to this throbbing headache. And that spontaneous activity in the brainstem as well and the trigeminal nerve can also cause what's called cortical spreading depression, or this wave of neurological activity that travels through the brain and is responsible in large part for the aura that a lot of people get, which is the visual disturbance or sound disturbance or nausea or even numbness in your body. There's a lot of different symptoms you can have, but the migraine is driven by the trigeminal system. And the trigeminal nerve releases a compound called CGRP, as well as other pro-inflammatory compounds. And this system is basically able to adapt over time. So as this system is sensitized by some layer of your body, maybe it's your neck that's sending some signals to your brain stem, that in the cervicotrigeminal nucleus, which is a little nucleus in the brain stem that takes this information and sends it up to the brain to be delivered to the higher levels of processing in the brain. And when this area has information coming from both the face and the neck, those signals can get crossed a little bit. And so sometimes when you have pain in the neck, you can actually feel it in the head instead, which is kind of confusing, but is why sometimes you feel that pain here and then suddenly it's up here. Or maybe you take a finger and you press in that area and you're like, oh yeah, I feel it right above my eye. Or some people feel it in different parts of their face or even in their teeth sometimes. But the interesting thing about this is that over time, your body is actually able to learn pain or become sensitized centrally.